Good evening to all. I warmly welcome you to our CellTalk webinar. In today's session, Isha will be presenting the research quality of YouTube videos on meningioma treatment using the DISCERN instrument. Our speaker Isha is working as a data analyst intern at Renix. Her work involves collecting data about professors of engineering colleges concerned with healthcare and research projects or publications. She is currently pursuing BA in English from Asansol Girls College. Prior to this, she worked with Babel AI as a transcriptionist. At Trinix, she has gained experience in not only data research but also the reorganization of information and the time management. So, without further ado, I would like to invite Isha to take over the session. Over to you, Isha.
Thank you, Yogita, for such a good introduction. And good evening, everyone, once again. I'm Isha, and I'll be presenting the paper titled Quality of YouTube Videos on Meningioma Treatment using the DISCERN instrument. This paper was written by three researchers and headed by Paulina S. Lazinska. This research paper was published in the journal titled World Neurosurgery in the year 2021, and it has an impact on meningioma treatment and patient education with an impact factor of 2.21. Meningiomas, as you know, are the most common type of primary brain tumor that arises from the brain or spinal cord, and the risk of meningioma increases with age. The complex nature of it has led to a number of myths and misunderstandings about the disease. Patients, generally want to learn about their illness and what the treatment choices they have. And a well-informed patient can play a better role, a better active role in the decision making for the treatment, and consequently experience less anxiety. But the healthcare specialist may provide the patients such an information that is insufficient, or either due to some lack of consulting time, or by providing information in such a way that it is not clearly understandable to the patient. Therefore, what many patients now do is that they browse the internet for readily accessible and available medical information. And with YouTube being one of the most popular sources of patient information on the internet, and that too with video interactive solutions, so patients don't hesitate from making the full use of it. And although patients can assess the medical information via YouTube, not everyone can assess the quality, the reliability, or the accuracy of the information. The biased or conflicting advice can not only lower the credibility of the clinicians but also harm the patients, especially when they rely on the internet for treatment choices, for choosing their treatment choices. Therefore, it is important to assess the accuracy of patient information on meningioma on YouTube. A meningioma, as you know, is usually a non-cancerous tumor that arises from the membrane surrounding the brain and spinal cord. Although the majority of meningiomas are benign, that is, not harmful, these tumors can become a problem as they grow and compress against the important parts of the brain or the spinal cord. But the most preferred treatment, as per the health specialist, is surgery, which has, of course, enough complications to scare a patient. So they prefer to assess the medical information about its treatment choices or alternatives from online platforms like YouTube. For now, the present challenge for us is that anyone can upload videos, including medical content, that has not undergone peer review, resulting in the degradation of quality of content on YouTube. The foremost objective was to evaluate the quality of YouTube videos as a source of patient education. A secondary objective for this research was to examine quantitative data, including like the video length, the source of upload, as if the uploader is a clinician, or is it from a hospital or a independent identity, or from a health information channel or educational channel. Then came popularity, which assessed the number of views per day, likes, dislikes, etc., along with the associations with video quality. So what happened was that a search was performed on YouTube on January 14, 2021, using keywords related to meningioma, like meningioma treatment, meningeal tumor treatment, meningioma brain tumor treatment, etc. Then, relevance-based ranking was used to sort the YouTube results. Relevance-based ranking is basically using advanced algorithm to rank records in order of relevance to the search term and importance to the user. And after that, the first three result pages of each search was assessed, noting that 95% of users conducting a YouTube search watch no more than the first 60 to 70 videos retrieved in the search results. Then, the review included video reporting how the treatment works, the benefits, risk factors, possible treatment choices for all meningioma. Then all the duplicate or irrelevant videos, where the latter were defined as videos not containing any medical information or false information, were removed. Video contents were then independently evaluated by fifth year medical students using the DISCERN scoring system for video analysis, which is a tool to assess the quality of YouTube videos. The further set of statistics was evaluated using the like ratio and video power index using the formulas as you can see given in the brackets. It recorded whether videos included features like symptoms of meningioma, risk factors during treatment, results of treatment, steps on how to perform the procedure, uh, discussion of the prognosis, brain anatomy, and most importantly, whether the speaker was a doctor or not. Further analysis was performed using different sets of tests like Shapiro-Wilk or Mann-Whitney test. To test the normality of data and to determine statistically significant difference for pairwise comparisons in future. As we can observe in the flowchart here, out of the 150 records that were identified through the YouTube searching process, 83 of the duplicate ones were removed in the screening process. Out of the 67 screen videos, 6 of them were excluded because of irrelevance, and one video was excluded for not being in English language. The remaining 61 videos were included in the further analysis. According to the DISCERN groupings apparent from the table we can see here, 34.4% of the YouTube videos are seen to be classified as very poor, which tops the table, which and 32.8% as poor, 11.5% as fair, 16.4% as good, and 4.9% as excellent, which is the least number of least percentage. As for the source of upload, most videos were provided by the health category, which is 31.6%, followed by hospital 29.5%, physician 27.9%, and at last educational categories with the least 6.6%. When the relationship between video features and total DISCERN score were evaluated, no significant differences could be observed between videos with or without the radiological findings, results of treatment, steps on how to perform a treatment, brain anatomy explanation, patient experience, or whether the speaker was a doctor. So this information somewhat indicated that the majority of the audience seeking the medical information on meningioma don't really get to the depth of the topic and also don't give much attention towards the uploader's credibility or how qualified they are. The DISCERN score indicated that the quality of information on meningioma treatment on YouTube is poor and the video content requires some serious improvement. The videos on YouTube poorly described areas of uncertainty, risk associated with meningioma treatment, and what would happen in the absence of treatment. Moreover, they provided little support for shared decision making. Shared decision making is basically a process in which both the patient and the healthcare professionals work together to decide the best planned care for the patient. So they did very little for this, but it can be noted that YouTube videos are fair at describing how the treatments work with their animation and motion things. Videos authored by the clinicians were associated with the lowest discern score. This can be because some of the films were made for marketing purposes, which in particular is a very disturbing and unethical thing, because the foremost priority for a clinician must not be gaining popularity or earning the views, but the safety of the viewer, who is the patient. Furthermore, a significant number of clinicians only mentioned one potential therapeutic modality and called it successful, despite not citing sources of evidence on treatment efficacy, which kind of hinders the broader view and makes you stay with just one option. It was reported that quality of information on meningiomas on internet is variable, that is that it changes every now and then. Also, it was seen that videos containing animations were considered more useful by patients and may help to improve comprehension. Therefore, diagrams and animations are crucial in creating high quality and engaging YouTube videos, because people tend to engage more on videos that are not only informative to them but are also visually appealing. The research, of course, had some limitations. First of all, only English language videos were taken into consideration, and that too from only one video sharing site, that is YouTube. Secondly, the distribution of information on internet varies daily. The findings may have been influenced by data collection on a single link. Also, the search results can differ at different times, so it can be said that the results could have been different if any of these limitations were subject. It was to be concluded that YouTube tended to be a poor source of patient information on meningioma treatment, with very less percent of 5% of videos of excellent quality and over two-thirds of poor quality. The impact of inaccurate videos on patient understanding of meningioma treatment must be recognized by healthcare professionals, because there are only a very few reliable and unbiased YouTube videos on meningioma treatment, and neurosurgical societies can uh, should be encouraged to provide high quality patient education videos on their websites or their own channels on the internet, so that the patients can frequently view the information and get the exactly correct results, accurate results. Such action would be extremely beneficial because it would improve access to credible information, while also serving as an important voice on the internet, where fake news is in abundance and overwhelming. Moreover, in the context of the epidemiological circumstances and a limited access to its specialists, it is critical that the quality of information be independently reviewed by experts. Also, patients should participate as evaluators to help collect insights on the content of YouTube videos and to give reviews of how the videos are. And because YouTube videos can improve over time, so further and continuing research is required to assess their quality, because if appropriately governed, YouTube has the potential to become a really reliable source of patient information on meningioma treatment in the future. Talking about the impact of this research, the healthcare professionals can be aware of the possible effects of inaccurate or unreliable YouTube videos on patients' comprehension of the disease, and what they can do is they can warn the patients against it, which can have a positive impact on the patient-physician relationship. Guidelines can be created for guiding the patients to credible sources of information, which can be one solution for overcoming the issue of misleading videos on YouTube. And what else can be done is healthcare providers may warn patients against searching for information about meningioma treatment on YouTube, which lacks credibility. The better we give personal opinions about them rather than search, rather than asking them to search things on YouTube. So yeah, that's all. You can find me at the mentioned email ID. Thank you.
Thank you so much, Isha, for this informative talk. Now the audience can have questions or opinions on today's talk. We have a question from Vijay. Does YouTube rank videos from reputed medical centers higher in search results, or is it just based on views?
The thing is, it is based on views. They don't rank those because if we open YouTube, the videos posted by the medical authorities or categories won't top the list. The top ones will for sure will be those videos which has better animation or are visually appealing. So and those get more views. So YouTube does that. It doesn't get.
Hope it answers your question, Vijay. Next question is from Nupur. Why videos by physicians get poor score?
This happens because they don't really try to give the information, and they just what can I say, they they talk off topic about the video. Clickbaits are used and all, and they don't provide the complete information. YouTube that's why the viewers don't stick to the entire video, and the credibility gets.
I think one of the other thing with that is, YouTube is a marketing platform, right? And the physicians, when the physicians or scientists, when they post videos, they are less interested in the aesthetics of the video and more interested in the scientific content that also tends them to push more towards the science or scientific terminology than the user, prefers to listen to. Is that
Yeah,
something you came across, Isha?
yeah, sir, it is correct. But the thing is that the viewers, for the when they want to see how the treatments work, most of the viewers have seem to be looking for videos for how the treatment works. So for that time, they
Yes.
engage in videos or like the animated videos and not on the
Yes.
videos by the healthcare professionals.
Yes. The animation works. And also remember, for a physician and a scientist, there is an ethical boundary. You can't just go and make a click and bait claim, right? Whereas
Yeah,
a non-physician or a non-scientist can simply, walk in and say, I can cure, for good or bad, Ramdev can cure COVID, So they can,
yeah,
they do not have the same ethical, moral responsibilities than non-physicians and non-scientists, right? And they
yeah,
tend to focus more on the aesthetics and animation that might, because end of the day, YouTube is a click and bait, right? It's a marketing
exactly.
platform, right? So, all right.
Okay. Next question is from Bharati. What improvements are required in the videos to provide more information to the patients?
The neurosurgical societies, as I've mentioned, can post videos that are more reliable than the independent entities on the YouTube. So they can post videos, and also they can to engage more audience. They can add a little of animation with credible information, as such as if the doctors are there, yeah, they can.
I don't see further questions coming from the audience. Again, I want to thank Isha for this educational talk. I'm sure all of us can have a takeaways from this. Isha, can you move to your last slide?
Yeah.
Thank you, Isha. Before we conclude this webinar, I would like to inform everyone that our next presentation will be on 15th March 2023, and Vijay will be presenting research titled Multi-omic Analysis of Low-Grade Glioma Histological Subtypes Uncovers the Significance of Tumor Purity. I would like to thank you all for your time and kind attention today. Hope to see you all at the upcoming presentation. Thank you so much.